So it is a roundabout circle that yes, sugar and carbs affect cholesterol. Your insulin resistance, then pre-diabetes, then diabetes. And they say it is the most predictive test on whether you are going to become or at risk for diabetes.
Talk a little bit more about triglycerides.
Well, okay, a triglyceride, for instance, when you consume fructose, like in high fructose corn syrup, that kind of stuff, all right, our body can't use fructose. It says, I don't know what to do with this. So it sends it to the liver. Liver says, I have a solution. I'll take 3 of those dudes and we'll tie them to this glycerin molecule and we'll call it a triglyceride and you can use it for fuel. So it's like, see, our body runs on 2 fuels. And it's sort of like a diesel and gasoline both. Gasoline being glucose and diesel being triglycerides because it's basically fats that the body has made things in like that into a fat. And when you pinch an inch, you know, you've seen those old commercials about pinching an inch on your belly. Hey, you're pinching triglycerides. That's how they're stored. So our body stores, either uses them for fuel or stores them as fat.
And the people that actually have the higher levels of triglycerides are the ones that tend to gain weight in the middle.
Yep.
When you have people come in, it talks about I gain it all right here. And you can almost tell what their triglycerides are going to be when you actually do their test.
They're going to be over 60.
People that gain weight everywhere doesn't tend to have the higher triglycerides, and they can, but the people that gain it mostly in the middle almost always have the high triglycerides. Now triglycerides, people always come in thinking that fat is what's make triglycerides, and that's not true, it's sugar. So
Mostly.
Eating too much sugar and too many carbs are what actually elevates triglycerides. Now cholesterol will be increased by bad fat consumption, but the triglycerides will not. And triglycerides really are what causes the bigger risk. And so and then some people have high of both. If your triglycerides get too high, then you have to elevate your VLDLs, and then that elevates your cholesterol. So it is a roundabout circle that yes, sugar and carbs affect cholesterol. Although high fat can affect the cholesterol, but it doesn't necessarily affect the triglycerides.
Right.
So that's kind of the misconception out there and that we hear a lot. And so that's why we wanted to let people know you've got to do stuff to lower the triglycerides. Now, when we talk about the NMR, which we just mentioned, it's a better test. It checks a lot more things. It doesn't just do cholesterol, it does the particles. Well, particles carry the cholesterol, and particles are what is sticky and can kind of get in between things. And it also checks your total, and it checks the small ones. The small ones are the worst.
Yeah.
They can get stuck easier. So small particles are worse than big particles. Now, it also checks on the LDL size, it checks the size of your LDL. Because some people have the big fluffy ones, which are not near as big of a problem as little bitty dense ones. So that is also measured on an NMR. Now an NMR also gives you something called the insulin resistance score.
Yeah.
It looks at 6 different values, and some of them are in the background, you don't even actually see them, on are you insulin resistant? And what is insulin resistance? Turns into diabetes.
Pre-diabetes, basically.
Right, so you have your insulin resistance, then pre-diabetes, then diabetes. And they say it is the most predictive test on whether you are going to become or at risk for diabetes. And if you are at risk for diabetes, diabetes increases cardiac risk greatly because it affects all these people that are diabetic and have sugar problems tend to have the small, dense particles. So it kind of it gets confusing, but there's a lot to it. But
Just go get the NMR test. And
and we'll explain it.
We'll just quit arguing about it. Just go get the NMR test.
Well,
can they just come take that?
Yeah,
Oh,
they
yeah,
can, as a matter of fact.
it is.
You know, one of the things, you know, the old test, the Friedewald test, is cheap. Okay, the NMR costs you a little bit more. It's not terribly bad. Okay, so it's a little bit more expensive but you get so much more information. You get to look at those particles and you get to see how many of them you got. Because if you got you take 2 different people and they got an LDL fraction of say 150, but one's got really high particles. I mean, it takes a lot of particles to make up that 150. Where the other person, they got 150 total LDL, but they got just a few particles. So those particles are the little protein sacs that actually carry the cholesterol. And the less particles you have, the better off you are. And then the size is another thing.
Yeah.
And being able to check the size is huge because no other test gives you that size. You have to be able to see it. Again, back to an NMR, which is the MRI of the blood,
Right.
so you can actually see those things. So that's a big issue.
There is another test that, okay, you do the NMR, you think it all looks okay, or if it don't look okay. Something that makes it even worse is if your LDLs are oxidized.
Yep. Reason being, when they go into these cadavers and people who've had heart attacks and died of stuff like that, blocked arteries, etc., the cholesterol that they pull out of those plaques, it's oxidized. The non-oxidized cholesterol doesn't cause problems. It's the oxidized LDL. Because when it's oxidized, it becomes very sticky. And you take those small particles.
And it clogs up your arteries.
It starts actually getting into the cell, into the lining of that artery, and starts blocking it and building up, and they starts accumulating. That's when you get the foam cells, you get the whole schmidge. That's just really a mess. Yeah, no doubt about it. I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.